want to understand what genes are behind both health and disease, between drug response, why some people respond to treatment, and why some people get severe side effects from different medications, even up to like allergic reactions. So all of this is super important for guiding healthcare in the future.
Welcome to the Digital Government Podcast. Tune in to discover the future of governance and ways of getting there.
Welcome back, everyone, to another episode of the Digital Government Podcast with your usual host, Federico Plantera, journalist, a sociologist, and researcher. Today, delving into a topic that is probably, we could say, at the intersection between data policy, but also the use that we make of these data, and specifically with a case study, maybe we could say, on or from healthcare. So what we're going to talk about today is how data and trust can actually enhance, let's say, a future that is targeted and oriented towards prosperity with lessons that we're learning from genetics. This was also the name of the closing keynote at this year's e-governance conference of Lili Milani, who is today's guest, and she's the head of the Estonian Biobank and professor of pharmacogenomics at the University of Tartu. Lili, welcome to the podcast.
Thank you.
Lili, let's get right into basically this very interesting question. Like, how are we basically building a connection between genetics, the work of the biobank, and also the main topic that we have addressed, the main theme of this year's e-governance conference, which was From Bites to Benefits, no? I think that when we think of the sentence in itself, exactly, from bites to benefits, the benefits are not just in terms, at least the way that we have thought out about the word benefit is not just in terms of cost savings for the public administration or a direct economic impact in terms of, GDP increases, but also things that affect and involve other spheres of life that are still, in any case, important and relevant to the public individually, and also as a collective body, I would say. So individually in terms of recommendations and behaviors, but also collectively in terms of what we could do with those learnings to derive perhaps some public health policy recommendations and directions. So starting from exactly the role of data, no? From the biobanks to public value, let's put it this way. How can data collected for one purpose, like for example health research, no, then become a resource for broader policy and economic benefits? The question here is basically, what was the original purpose and the vision, let's say, behind the biobank? But then how has that evolved in practice over time?
So the initial goal of the biobank when it was founded was to do genetics research, to make discoveries that would drive medicine forward, like knowing more about which genes are associated with what diseases and how this information could be used in improving healthcare, and also to advance public health. So how we understand or define this advancing or improving public health is really, it can be like abstract or like distant, indirect, that yes, all these discoveries tell us more and healthcare will improve, or we can make it very direct, which it finally became in Estonia's case, where we actually started returning results directly to biobank participants, and this was very useful for their management of their health, for prevention of disease, for improved therapy, and many different topics that we've covered.
So what are some of the projects or like initiatives or lines of activities of the biobank that we can maybe like illustrate, let's say, to our audience exactly to understand what the biobank does, and also what is your way of leveraging exactly the data and using the data that you have? Then we will also get to talk about handling of this data. But in the first place, what could illustrate what the biobank does, let's say?
So let's start from the beginning, that to become a biobank participant, you sign a broad informed consent that allows us to update the records with your electronic medical records, all the diagnosis, medical bills, prescriptions, medication use, procedures, and all that. So all that information together with questionnaire data that people have filled in themselves, like self-reported physical activity, diet, smoking, different habits, are then all stored in the biobank. Then they also donate a blood sample from which we extract both DNA and plasma for further analysis. And so far we have genotyped all biobank participants. That's 212,000 individuals, 20% of the adult population of Estonia. And this data is being used on a daily basis for research. And people are studying cardiovascular disease, cancer, type 2 diabetes, reproductive health, female health, and response to medications is what my group is working on. So we really want to understand what genes are behind both health and disease, between like drug response, why some people respond to treatment, while some people require more intense therapy, and why some people get severe side effects from different medications, even up to like allergic reactions. So all of this is super important for guiding healthcare in the future. And I think that as scientists, we have maybe been a bit naive, thinking that I do the research, I publish the paper, and I throw it on the other side of a wall, and there will be somebody there to like pick it up and start implementing it in the clinic. But what we have seen over the years is that there is nobody else on the other side of the wall. There's nobody there to take your research and start implementing it. And I think both as researchers, people are getting frustrated that we want to do something meaningful, we want this to actually get somewhere, we don't just want the papers. And we also hear from people, and especially these biobank participants are very eager to receive information, they want to know. So from the beginning, we started doing smaller scale recall studies, we call them, so based on genetic findings. We would call people into the clinic, and they, of course, first get a choice whether they would like to participate in a study where we return results or not. They have the right not to know. And then once they come into the clinic, their finding is confirmed, and then they get genetic counseling about, for example, if it's a breast cancer mutation or another mutation that gives them very high cholesterol levels. They can exercise and stay slim but still have very high cholesterol levels and at very high risk for early heart attacks. So all this information is very highly relevant for people's health, and we realized that getting this into the clinic will take very long. So we also wanted to study how people respond to receiving this kind of information and how it manages their health and so on. So that's why we started doing these recall studies, and then it expanded, like, okay, we have covered these rare mutations that is like 1 in 150 or 1 in 200, and still we see that like 10% of the population is at much higher risk for cardiovascular disease or type 2 diabetes. And then we have started studying these, we call them complex diseases. So you have a genetic predisposition for disease, but whether you get it or not is highly dependent on your lifestyle. And that's when we built the Estonian Biobank's My Genome portal, where people could then log in and see both their genetic predisposition for these diseases, but then in cumulative risk models that integrate and are interactive, where you can like enter your body weight, your smoking status, and play with these factors to see like, okay, if I quit smoking and lose 10 kilos, how does that influence my total risk or 10-year risk?
Super interesting. This actually, you've already touched upon one question that I myself, as a researcher, in any case, someone who has done research in academia, a question that I've asked myself quite a lot in the past, and it is, okay, but of all of these research papers and conference papers and symposium like research article, peer-reviewed articles production, what do we do of all of this wealth of knowledge that we're producing? Let's say, like, where does it get aside from just, you know, the publications, let's say, or the symposium or the conferences? And I think it's very, very interesting exactly the fact that some research that could be considered as highly scientific and perhaps not that niche, but still in any case could be considered that in the eyes of the general public, then has been sort of operationalized in a way to be and put to work in a sense. I like to see and I like to hear that this has happened. You mentioned the portal. Well, I will ask you exactly about that now. I like to see that this has resulted basically in a portal somehow. And what happens basically then on this portal? How can people use it? And is it something that is more targeted and tailored for personal recommendations? Or does it also carry some more collective public health kind of value? Because if it's public health, then it's also public good. And if it's more targeted for like personal recommendations, or also has like a public value, public utility, like public policy type of use?
So overall the risk models and all the information that the person receives is based on their personal genetics, their personal lifestyle, but the recommendations that they get are based on WHO recommendations for how to stay physically active, what to eat, and like all of this is just personalizing the individual's risk, but giving very broad public health recommendations that kind of, we were hoping to emphasize and really connect with what society is telling you. But
so if I go on the portal and I have, obviously in order to use the portal, I will have needed to previously give my data, no? And obviously like consented to the use then of the data and supply the quote unquote evidence that you have mentioned before in order for then get a result in something that I can adjust and some variables that I can see change or not. Could you like visualize it, let's say, for me in this moment? Because I'm not a participant in the biobank, but I'm very interested in knowing then, if I go then on this website, what can I do? What can I find and what can I see? And what can I find out about myself at that point?
Mm-hmm. So when you log in for the first time, then you have to fill in a kind of dynamic consent, which you can change later if you want to know more, but you can choose. Maybe you only want to know about your pharmacogenetics, like how your genes influence drug response, or maybe you only want to know about cardiovascular risk. So you can pick which results you would like to see. And then you sign the consent, and then you go in, and then everything is calculated there on the spot for you based on your health data and genetics. So the different topics you can look at is then your genetic and cumulative risk for cardiovascular disease and type 2 diabetes. And both of these reports are built kind of in a way that it starts with your genetic predisposition, whether you have high, average, or low genetic risk. And you can see how you are on a like population scale, on a normal distribution of the population. And then once you have seen that, then you can continue further, and we tell you that this is not it. You may have this genetic predisposition, but what is even more important for this risk to become realized is your lifestyle. And then you can play with your lifestyle factors, so you get like a visual of your 10-year risk or your risk by the age of 70. And there you can then see on the left side you have your risk factors that are used in the model. So it's then, for example, body weight, your cholesterol level, blood pressure, and smoking status. And then you can change these. Let's say you enter like if you plan to lose 10 kilograms or lower your cholesterol a little bit and improve the diet and stop smoking. Then on the right side, the graphical interface, you will see that how your risk changes, whether it then is reduced 10% or 20% and so on. So both of these reports are interactive. Both the cardiovascular and type 2 diabetes. And then you have the pharmacogenetic report, which kind of explains how your genes influence drug response, and it's maybe more clinical and something that doctors would find useful. But you can share it with your doctor, and they decide whether they want to use it or not for the selection of medication.
From the sound of it, and also considering that all of this work resulted also like in an online portal that people can consult, I'm drawn to think that obviously this thing, in order to take the shape that it has at the moment, and for the biobank exactly to also return somehow to the public, let's say, this sort of tool, there were definitely some key enablers that needed to be there in the first place. No, I would say that these could be possibly divided into like hard enablers and soft enablers. No, so if on the soft enabler side we definitely have trust and the topic of consent and everything, we will get to that in a second. What were instead the digital enablers, let's say, that make this possible?
So first of all, it was about design and user experience, because this initial, like the pilot version of this, was all designed by scientists, and we are not good communicators outside of scientific conferences. So,
but ace in scientific conferences within the borders of a scientific conference.
Yeah. So then we had a user experience team that really took our reports and tested it, and interviews and different personas, highly educated, lower education level, different age groups.
How would you explain it to your grandma? No, this
Yes,
is usually the
exactly.
thing that is said. Like, pretend that you are explaining this to your grandma, so that you would use the most like streamlined terms possible.
Yeah. And then they came back to us, and they had changed our reports quite a bit, and we said, okay, so if you say that this is what people understand and it helps people really grasp what we're giving them, then this is fine. And then we had, of course, the design team and the front end and back end developers, so it became a huge ICT project. And the programming all of this into one portal that then in live can calculate and change and draw and visualize all these risk profiles for you was a lot of work. It took at least 2 years. And then finally, the different regulations, getting through ethics review and approval for how we could actually start this and do it. And then legal compliance with the health board showing up and telling us that no, the medical device regulation applies to you, and because you're using algorithms that use genetic information. And we were arguing against it, that no, this was we're not a healthcare institution, we are a research institute. We are only returning results, and we have disclaimers that this is not medical recommendations or guidelines, and it is just for educational purposes. And they said, no, if people perceive it as medical information, the medical device regulation applies to you.
Interesting point, this last one, actually.
Yeah. We were quite frustrated because it delayed our project another 6 months. But finally,
and we are scientists.
Yes.
we need to get to the bottom of this.
Putting scientists writing the 70-page documentation. But in the end, I think it was good. It was good to think through all of the risk assessment, all of the full documentation of every step that we had made in selecting the different genetic variants to final information that was provided to a person. It was actually an important step that we took.
I'm assuming that the fact that in Estonia the health data and the health records are already have been already electronically for some time also helped you, no, in order to build this tool.
Yeah, definitely. All our research is based on all these electronic health records, and we also built this kind of transparency into the portal, so that although their risk profiles are pre-populated with the latest data that we have on them, they might not be aware that we actually are importing data from hospitals, from primary care physicians, all the medications and their blood pressure or cholesterol measurements and so on. So it also was one of the purposes is really to increase our data transparency with the participants of the biobank, the people who are sharing the data, to increase trust.
to increase trust. Very important point, because I think that this instead connects like to the rather soft side of the enablers that I was mentioning before. This is what I was hinting at, because data, I would say, I would add to what we're saying, that is only as useful as also the trust that underpins the usage of this data, no? And also who is using this data and what are the provisions for using this data. So I'm assuming that this requires like a solid framework for like data governance, let's say, no, behind it, especially when handling such sensitive information such as genetic data. So the question that I would ask you on this: how does how basically the biobank has engaged with citizens on the question of consent or like reuse or transparency, and also like what has been the response? Because you have already highlighted that there are people who are interested in using this tool, who want to give their data, who want to have information in return. So it means that there is an underlying relationship, let's say, between the researchers and the researched. But then how has this been explicitly brought up in order to have trust supporting this project of the biobank?
So I think it's a longer process. It's starting off with recruitment. When people joined the biobank so it started early 2000s. We didn't even know anything about genetics and disease to return to people. So those who donated samples, the first 50,000 biobank participants, they joined in 2004 to 2017. And the whole campaign and everything was saying that a biobank participants extends a hand into the future. Like, don't expect anything for yourself, but for your children and grandchildren, maybe. Yes. And then, based on these first 50,000, we did a lot of research, we made discoveries, we started returning some results to a few of them. And this was used also in the media and of course science communication, that this is super important. We're so grateful to all these biobank participants. And then in 2018, we got a bigger grant from the Ministry of Social Affairs to recruit another 100,000 biobank participants, like mobilizing 10% of the adult population to go and sign a consent, donate a sample. It was a huge national campaign. And just by December, we made it to 100,000. And I think many stakeholders were like, we didn't believe you could do it, but we did it. And in that campaign, we did use much more storytelling and basing it a bit more on personal benefit. That look, this person found out about their high risk for side effects from antidepressants, and they had actually experienced it, and they were telling their stories in the media. And although we were not directly promising that if you join, you'll get this information tomorrow, many people came with that expectation. So that's where it all started, where we realized that, okay, we actually built this expectation that everyone wants to know something, not just those where we find breast cancer mutations and familial hypercholesterolemia, like high impact monogenic findings, but people want to know broader things. And that's when we got to starting to build this broader portal and thinking of what kind of softer information can we share with people that doesn't require one-on-one genetic counseling, that, okay, you have this cancer risk in you, but these and these steps can help you prevent it, or if we can diagnose it early, you have a much better chance of survival, and so on. So, yeah, it works on many different levels, and it's quite a complex approach.
But Lily, you've just mentioned how basically in the beginning there was this, the horizon of the project and of the results that you were returning to the public. I think it's important also that we're using the word like returning to the public. No, it's like it's a social dividend. It's a personal dividend based on healthcare and health information and awareness. But then it's also like a social dividend, because it comes not only to be relevant for your children or grandchildren, but actually also today in the present for the wider awareness and the consideration that we have of public health and a society overall. This hints at the topic that there are societal returns also from like digital projects that maybe cannot be measurable in, this allowed me to save this much money on paperwork, but that actually instead shine a light on the more distributed and wider returns that we can get from digitalization and digital projects. So in this line of thinking, what long-term public value, let's say, has already emerged in the sense from the work of the Biobank? And I would say that could this be looked at from both or either a perspective of personalized health services or better targeted public policy?
I think we're kind of doing both. So instead of waiting for these new healthcare services to fall into place and find funding for them and do a cost effectiveness analysis and all the different bits that need to fall into place before we can use this information in the clinic, we are able to return this and use this information to biobank participants directly today. So that is a very important direct benefit that we see. And also thanks to doing this, and of course we are doing it as studies, it's not clinical work per se, doing this kind of studies and showing how much useful information was gathered and how much in earlier stages the cancers could be diagnosed, this really helps shape health policy. So I think what Estonia is doing is quite unique, because if you go to Germany, for example, they have an excellent biobank. UK, the world's most used biobank, super open for all researchers across the world. And they don't return results to biobank participants. None of them. And they were not built that way, and they will not do it. And for example, if you speak to the German biobank heads, they will say that no, this biobank was built for research, for studying how long does a person with a breast cancer mutation live. If we start intervening with that, then we will change it. And I think that's a very interesting attitude that we strongly disagree with. If you can change something like that, we want to change it. If we can extend people's lifespan, we want to expand it.
Why not having basically immediate and then also lasting impact with information that you're finding out? Definitely shows, though, that there had to be like a different way of thinking about this, like, and different motives, let's say, at the very basis behind doing this across countries. This actually leads us to, first of all, the fact that we are approaching the end of this episode. So I would ask, there's a bit of like an elephant in the room type of question that I will ask you now, which regards more, for example, ethical concerns regarding this. But I think that then, exactly following your last example and your mentioning of the other countries, then I think we could address it in this way. So if Estonia's example, was in Estonia's path, let's say, with the biobank, was to be scaled or adapted elsewhere, like in other countries, what should governments, in your opinion, or like public institutions, really like get right, in a sense, from the beginning? Because I think that this is important in what we're focusing on, in order to ensure the success of this type of initiative. But then what should be, as digital societies evolve, also the concerns and the things to watch out for from a more ethical standpoint that should be embedded in this approach that governments have to developing something like the biobank works in Estonia?
Yeah, I think the first thing that countries need to put in place is a law, like biobank law. We had it, so before starting the Estonian Biobank, which was founded then by Andres Metspolu back then in 2000, the first thing they did was to pass the Estonian Human Genes Research Act. It regulates everything around the biobank, from consent to how the data is used and ethics committee approvals and everything. So this is crucial in ensuring that people feel that their data is stored securely. There are very clear rules, what we're allowed to use the data for, what we're not allowed to use the data for. And this law, although passed like 20 years ago, has been very actual until now. Just this year, it's going under a revision to make it more compliant with other laws that have emerged and so on.
2 decades of this law.
Yes.
Wow, that's impressive.
Yeah, and I have heard of biobanks in other countries that have had to close down because they just started a biobank and then they realized there's no law governing the biobank and it was chaos and they just closed down the entire biobank. And
so, for example, when it comes to the attention that we're putting, that we're putting on data today and also like in the next years, considering that exactly as more algorithms, as more machine learning, as more artificial intelligence tools are implemented and rolled out across the public sector, but also across the private sector, then here we're talking about very valuable data. No? So you're basically saying that these ethical concerns should in any case be part of a document and should be something that is taken into consideration from the very beginning, no?
Yeah, and I think this, one is the legal and second is the ethics. That's what really has helped our scientists is that we have one broad ethics approval for our institute. And the research we're doing is based on this one broad ethics approval, which allows us to study the roles of genes in disease. And we're very specified like how we do it and where we do it and so on. But imagine if we had to submit a new ethics application to the ethics committee for every new disease or trait we wanted to study. So this is one very important bit, and I think that we need to do something similar for AI-related projects, and we are now in several EU projects where we're doing federated learning, which means that we're using AI across biobanks, across electronic health records, and the data stays in its safe location, and these models are going and training and working across these different countries and sharing the summary statistics and then coming back and improving and then going back and forth. So this federated learning approach also is something we need to solve together across borders.
Lily Milani, thanks a lot for having joined us today for this episode. Very interesting. I heard many new things, have a lot of food for thought. So, and obviously that was coming from the head of the Estonian Biobank. So thanks a lot for this.
Thank you.
I would say that the last point that we highlighted also hints at something, and it's meaning the fact that thinking of regulation carefully, but also then while you do that, taking into consideration ethical concerns regarding the use of technology and the use that we do of data also allows you to not miss on opportunities for using these tools and actually leveraging them, not just for exactly individual responses or in the individual return of data and information about people's health and behavior, but also for the public good more at large. And with this, I think that that's it also from your host for the day. So this was Federico, your usual host of the podcast, and I will just be waiting for all of you in the audience at the next episode of the Digital Government Podcast.
This podcast is brought to you by the eGovernance Academy. Tune in next time.